Good day, I am Jessa Corpus, a nurse student from Medical Colleges of Northern Philippines, and today I will going to perform a cranial nerve examination. So, good morning, sir. I am Jessa Corpus, your nurse for today. So, for verification, sir, may I ask what is your name? And your birthday, please?
October 4, 2000.
And today, sir, I am going to examine your cranial nerve. Is that okay with you? Okay, so, prior to performing procedure, first I am going to perform hand hygiene. Put on gloves. And prepare work area. So now I'm going to assemble equipment and materials. Different items to smell like soap and coffee, a newspaper or other printed materials like snail and chart, a pen light, cotton ball, sugar solution, salt, tongue depressor, gloves, and now I'm going to prepare work area. So first I'm going to test the olfactory nerve, which is responsible for the sense of smell. I will check the nasal passages are clear. Okay, so I'm going to ask the patient to close his eyes and shut one nostril with a finger. So sir, can you please close your eyes and shut your nostril with that one finger? And I'm going to present well-known odors and you're going to sniff and identify it. Okay, sir, can you please close your eyes? And then, okay.
Coffee.
Another one.
Soap.
Okay, that's all, sir. Now I'm going to test the optic nerve. It's apparent to the brain, responsible for the sense of vision. And first, I'm going to test the visual acuity by using the Snellen chart. 6 meters away from the patient, testing each eye separately. If the patient uses glasses, ask to put them on. Ask the patient to read top down until he can no longer distinguish the letters. Okay, sir, can you please stand at 6 meters away? Here. And you're going to read this Snellen chart up to down. Now cover your right hand with your right eye. Okay, now start.
FP TOZ LPED PECFD EDFCZP REFELOPZD DEPPOTEC LEPODPCT FOTCET.
Okay, sir. Next, sir, your left hand cover with your left eye. And then you're going to read it top to down.
E F E T O C L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L CFODTCT.
Okay, sir, that's all. Now I'm going to test the visual field or the confrontation test. I will ask the patient to cover one eye and look directly into your opposite eye. Shut your other eye and wiggle your finger in each quadrants and ask the patient to state when the finger is seen. Okay, sir, can you please cover your one eye and I will cover mine. And then I will move my finger. I will move it in the four quadrants, and as you see it, can you say okay, please?
Okay.
Okay, now?
Okay. 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 Okay.
Okay. Now I'm going to test the light reflex papillary reaction. Ask the patient to look forward as shine the pin light obliquely into each pupil. Papillary reaction should be noted on the eye. Examine direct response and on the opposite eye indirect or consensual response. Okay, sir, I'm going to test your papillary reaction. Straightforward, sir. Okay. Now I'm going to test the oculomotor nerve. It is apparent to the brain. I will going to examine the cranial nerve 3, 4, and 6 nerves. So first I am going to look for ptosis and skin. Okay, there are no signs of ptosis and skin. Now I'm going to test the light reflex or the papillary reaction. So next, I am going to test the accommodation. Okay, sir, can you please focus on my finger, and I will move it nearer to your nose. Okay. Okay. So next, I am going to test the H shape and the exam or the extraocular movement. I am going to move my hand and then follow it, sir. Okay? Okay. Next, I'm going to test the trigeminal nerve. Sensory ipsilateral face general sensations such as touch, pressure, temperature, pain, vibration. Anterior two-thirds of the tongue. Motor, which supplies muscles of mastification. Okay. Now I'm going to ask the patient to clench his teeth, then feel the masseters and estimate their growth. So, sir, can you please clench your teeth and I will feel your masseters and estimate their growth. Okay. Now I'm going to ask the patient to open his jaw against the resistance of my hand, and note any deviation. Sir, open your jaw. Okay. So, to test the two reflexes, first I am going to test the corneal reflex using a dump of cotton wool lightly touching the lateral edge of the cornea while the patient look upwards. So, I'm going to use the cotton applicator to test the corneal reflex. Okay, sir, look upward. Okay. So, next is the jaw jerk or reflex. I will ask the patient to let his spout hang loosely open. I will place my forefinger in the middle between lower lip and the chin, then forecast finger with the hammer, and I will note any reflex. Normally it is absent. Okay, sir. Can you please open your mouth hanging loosely, and I will place my forefinger. I will forecast my finger with the hammer. Okay. Okay. Okay, next I am going to test the facial nerve. Taste sensation. It is a taste sensation of anterior two-thirds of the tongue. Will dip in sugar, salt, vinegar, quinine solutions with rinsing his mouth out between each test. Okay, sir. I am going to dip an object to your mouth and you're going to identify it. So, close your eyes first and then open your mouth. I am going to dip an object. Okay, what is it?
Sugar.
Okay, sir. Drink a smaller amount of water. Okay, sir. Close your eyes. Open your mouth, sir.
Vinegar.
Okay, drink a small amount of water. Next, sir. Open your mouth.
Salt.
Okay, that's good. You want to open your eyes, sir? And drink a small amount of water. Okay, that's it. So next, I will note any symmetry, full face blinking, eye closure, or eye flattening, or the nasolabial folds. So next, I'm going to ask the patient to wrinkle or look upward. So, sir, can you please look upward? Okay. So next, I'm going to ask the patient to bare his teeth. Can you please bare your teeth? And then screw his eyes to keep them closed while I'm trying to open them. Screw your eyes, sir, and I will try to open them. Okay. Okay. So now I'm going to blow. You're going to blow out of cheeks. Okay, that's good. So to test the reflexes, first I'm going to test the corneal reflex, and I will use this cotton applicator to test the corneal reflex. So, sir, can you please look upward? Okay, next, sir. Okay, that's good. Okay, next I will going to test the glabellar top produced blinking in response to the first several taps. We're going to tap this part. Okay. Now we're going to proceed on to test the vestibular ocular nerve by testing the whispered voice test. So, sir, I'm going to whisper the word and then repeat it as you hear it. Okay?
Thank you.
The other side, sir.
Thank you.
Okay, that's good. So now we're going to proceed to test the glossopharyngeal nerve and X vagus nerve, or the gag reflex. Some pleasant tests use the more reliable water swallow test instead in fully conscious patients, and observe for absent swallow, cough, or delayed cough, or change in voice quality. Okay, sir. You're going to say and I will look at the movement of the palate and your ovule. Is that okay with you? Yes, sir. Say Okay. So now I'm going to ask the patient to puff out his cheeks with the lips tightly closed and feel for air escaping from the nose. Okay, sir. Puff out your cheeks, and I will feel the air escaping in your nose. Is that okay with you? Okay. Okay, that's good. So next, we're going to test the accessory nerve. I will observe for any shoulder or neck muscle wasting or hypertrophy. Okay, sir, can you please charge your shoulders against resistance like this? Okay, now going to turn head against the resistance. Turn it, sir. Other side. That's. And lastly, I will going to test the hypoglossal nerve. I will observe for wasting fasciculation or involuntary movement. Protrude tongue and look for endovation or involuntary movement. So, sir, can you please protrude your tongue? Okay. Then move your tongue side to side, sir. Okay. So to test the power by asking the patient to press his tongue against his cheek while I will apply pressure from the outside. Okay, sir. Press your tongue against your cheeks. The other side, sir. Okay. So next, I will going to assess speech plus and swallowing as the patient drinks small amount of water. So serving this drink small amount of water. Again, sir. Okay. So now I'm will going to do perform hand hygiene and remove the gloves.